political spoof on the title, the not so fake news about workers' compensation. And regardless of your politics, what I'm going to try to do today is talk about what I call emerging trends in workers' compensation. And notice I didn't say emerging fads, because we're not going to follow fads, but these are trends, and these are things that we think that are going to stick around for a little while. So in the past, we've pretty much decided that we're going to cover things that are more coverage specific. But I think that coverage can be a little bit boring, and it's often misunderstood. It's not that it's not important. You need to understand what the benefits are associated with workers' compensation, and hopefully you all understand that there's two types of benefits that workers' compensation provides. One is medical, and the other is indemnity, which is lost wages. But today what I thought I would do is to give you all kind of a behind-the-scenes look at what is happening in the workers' compensation industry. Because I think that what you'll find is that it's going to explain a lot about the inner workings of underwriting and how insurance companies think. And it's important for you all to know that, because when your policy is coming up for renewal, you're relying a lot on your advisor to tell this story on your behalf. And sometimes that story gets left untold, and I think that the more knowledge you have, the better you're going to find yourselves in a position to understand what is going into your workers' compensation premium, what's going into the carrier's minds when they're looking at your account, when they're doing their underwriting. So with further ado, I'm going to give you the agenda for today, and we are going to keep it real, all right? So first, we're going to talk about the current state of affairs with the workers' compensation industry. We're going to talk about some emerging trends, some challenges that are facing employers. So everybody here in this room, this is some challenges that you may encounter, and some legislative changes. So we're going to go over the first three topics first, and then we're going to take a little break, and then we're going to go over the legislative changes. So at any point during this seminar, please feel like you can engage with me, because it gets kind of boring if I'm up here just lecturing. So anytime that you have a question, just stop me and ask a question. I'm going to be glad to see what other people in the group are doing, and I'm going to throw out some questions to you all. So that's the participation part of the seminar. So please feel free to offer your thoughts. I want this to be as interactive as possible. All right, so here is kind of the current state of affairs. And I'm not going to read all of this to you, but what I'm going to do is explain some of these bullet points. So you can see that in 2016, the combined loss ratio for work comp carriers was 94%. What does that mean to you? Does anybody know what a combined loss ratio is?
If it was 100%, then we were 6% below what the national average was.
Right. And so how does the carrier come up with your combined loss ratio? They take a look at the premiums that you paid, and they compare that to the claims that were paid out. So in this situation here, for every dollar that came in, they paid 94 cents on claims. So it's important for you to think about that, because when workers' compensation companies are evaluating your risk, a lot of times they're looking at that combined loss ratio. And it's important for you to know that, because they could either be looking at it on a 1-year basis, or they could be looking at it on a 3-year basis or a 5-year basis. Sometimes underwriting will look at a 1-year basis because that may be more favorable to the carrier, right? Look, we got to get some more premium. They had a bad year. Well, if you had 2 other good years behind that, or 3 or 4 other good years behind that, then you should be able to leverage that with the insurance company to say, you know what, accidents are going to happen, but overall, we have been profitable. And so that's my job, is to make sure that I'm looking at those combined loss ratios and having that discussion with underwriting. Because otherwise, what they see on the surface could be just a 1-year snapshot, and that's not a really good indication on whether or not the account has had adverse risk characteristics. The direct written premium countrywide grew about 2.4%, so there's a total of about $40 billion in the workers' compensation marketplace. Direct written premium in Virginia grew about 4%, and then some data that was recorded by Moody's indicates that there's about a 4.5% increase in payroll from 2015, which is a good thing, because that means that we went through the trend with the recession where there was a lot of return premium in the industry, and that's because we were overestimating our payrolls. And there were a lot of businesses that were cutting payroll expenses during the recession. So we've started to see that now rebuild. So we're about 4.5% increase over 2015. And you can see here's the changes in the average wages, about 2.5% up. Change in employment is about 1.9% up. And then this is good information for you that effective for policies that are in 2017, so everybody hopefully knows that on April the 1st, that is when NCCI, which is the National Council of Compensation Insurance, and that's the governing body here in the Commonwealth of Virginia and several other surrounding states, they set the base rates for all industry classifications on April 1st of every year. So the classifications that you see on your workers' compensation policies, every April 1st, they're reevaluating what those rates need to be for each industrial classification. So in 2017, the average was a 6.7% reduction. So on the base rate for industry classifications, it went down 6.7%. So that means hopefully that you're paying less in workers' compensation premium. That doesn't mean every class went down, because they look at it on a class-by-class basis, but the average was a 6.7% decrease. And Virginia accepted a 5.5% rate decrease for those 2017 policies. So it's a really advantageous marketplace right now for workers' compensation consumers. It doesn't necessarily feel like that though, right? I mean, who gets excited about paying their workers' compensation premiums? I mean, if you had the choice between an iPhone and workers' comp, yeah, I think you would choose the iPhone. But in Virginia, we have about the 3rd lowest rates in the entire country with workers' compensation. Our auto rates are about number 1. So you have to think about it relatively speaking. So in Virginia, as a consumer of workers' compensation insurance, we actually get a pretty fair deal. I thought it'd be good to show you just an employment slide so that you can take a look and see which industries are growing. If you look at this, this is all on a percentage basis. Leisure and hospitality is up 3.2%. Construction is up almost 4%. Financial, 2.5%. Manufacturing at just 0.1%. Health services and education, trade and transportation, professional services. I thought this was a good snapshot to show you because you can kind of see, if you think about our economy here in wherever you are in Virginia, this is what's happening countrywide. Sometimes I think as we get closer to Southwest Virginia, it takes a little bit longer for that tail to catch up to us. But this is countrywide what those averages are. I just saw today that Alltech, I don't know if you all saw that news, but in Botetourt they're going to be bringing that in about 160 new jobs. So that's a manufacturer of truck and auto parts. Is that right?
Yes, those bucket trucks.
Okay.
Bucket trucks.
Okay, yeah. So there's been some good news in our region. It's nice to hear that there are other industries growing besides the beer industry.
That's right down the street from Alta.
Exactly, yeah. All right, now this is something that I want you to pay attention to because these are underwriting results. All right, so if you look at this shows you from 1990 here at the bottom all the way to 2015, which is the latest results that we have showing the combined loss ratios. So these are combined loss ratios for that 25-year period. All right, so if you look at the line over here, that's the top line, that's 125%, it goes all the way down to 85. So you can see in 2015 at a 94% combined, we're looking pretty good. But if you look at historically where the workers' compensation market has been, you can see that there are peaks and valleys, and it almost looks identical, but the curve is getting a little bit shorter. The reason that I tell you that is because now more than ever, underwriting profit is what carriers are concentrating on, because they're not making the type of returns that they did at one point in the stock market. And you're looking at the stock market and you're saying, yeah, right, because the stock market is just going bananas right now. But there are certain things that insurance companies can make investments in, and they make very conservative investments. They don't make investments in like the S&P 500, for example. They're at very, very conservative portfolios. So I'll show you what those portfolios look like. But the reason that this is important to you is because when we go through these peaks and valleys, that's typically when you're seeing the insurance companies moving into a different marketplace. And so with insurance, we call marketplaces either soft or hard. We really don't say that there's anything in between. Right now, we're sort of more in the in-between, a little bit closer to soft, which means that insurance companies are a little bit more aggressive on pricing. And the reason this is also important to you is because it has changed the way that insurance companies perceive their underwriting. Because now more than ever, they're not looking at just your loss ratios. They're looking at what they call characteristics of your account. And how many people here have had to fill out what they call a supplemental application or a questionnaire about your business? Yeah. They ask a lot of questions, and those questions a lot of time are built into algorithms that the insurance companies have. So when they input your data into their underwriting model, that's an algorithm that looks at the characteristics of your account and then helps the underwriter determine the pricing. So they're not looking at past performance so much as they're looking at future indicators of profitability. And that's changed insurance greatly because it's not only on workers' compensation, it happens on personal lines, and you've probably seen some commercials where you can put these little boxes, they're like little black boxes that they have on the airplanes that can monitor your speeds and monitor your driving habits and your behaviors. Those are underwriting tools that they're starting to introduce more into the marketplace, and workers' compensation is not an exception to that. So what I want you to take away here is they're focusing more on underwriting results now than they are just about their portfolios. And here's the main reason. So here's what you can see. We have bulleted as far as the investments. We have over $1 trillion invested in assets, approximately 69%, which makes up about $862 billion of that $1 trillion is in fixed income debt securities. So 44% municipal bonds, 24% fixed income, 19% mortgage-backed bonds, and 13% treasury and government bonds. And then what I put down here is that the investment gains have declined each year since 2013. So when the presidents of these insurance companies are looking at these results, they're saying, we got to figure out a different model because this is not giving us the type of return that we want. So a 5-year treasury bond produces a 1.92% yield. A 5-year mortgage-backed security is 1.9%, and a 5-year municipal bond is 1.37%. That's not a huge return on investment. So they focus more a little bit on the underwriting side because they feel like they've got more control over that. But I thought that was an interesting slide because I think that you see the stock market shooting up, and a lot of times the investment yields help determine a little bit about the marketplace, whether it's going to be soft or hard. If they're making more money on investments, then they're able to do a little bit more on pricing, and there's a little bit more flexibility in the marketplace. So these are things that we pay attention to in our industry because it gives us a little indicator as far as what the marketplace conditions are going to be like. All right, now we're going to get into some of the fun stuff. These are some emerging trends that we have in workers' compensation. So we're going to talk about the distribution of medical and physician costs because I think you'll find it interesting, and it really correlates to some degree along with health insurance. And hopefully my health insurance comrades will back me up on this. And we're going to talk about data and predictive analytics, and we're not going to talk about it on the front end, so that's the underwriting end. We're going to talk about it on the claims management side because this is something that you also need to understand. We're going to talk about telemedicine, marijuana and workers' compensation, and provider reimbursement rates. Okay? So let's take a look at the first one here, which is medical and physician costs. And this will give you some percentages. And there's a reason why I'm going to show you these because there's a punchline at the end. But if you look at from 1995 to 2001, the medical price inflation increased about 16%. And utilization of medical services increased 56%. So there was an overall combined increase in medical lost time claim severity of 72%. So what did that do to pricing? It brought pricing up. And if you look, if I showed you that graph again and you looked at these periods, you can see that the combined loss ratios were going up, but so was the rates for workers' compensation. In 2002 and 2008, we saw a similar rate increase in medical price inflation, but utilization started to slow, meaning that carriers got a little bit better at making sure they were directing employees to appropriate care. So who you have treating your injured employees makes a big difference. That's the utilization piece of this. So during last year, medical cost inflation rose about 5% and the utilization change was almost non-existent. So what did that do? That helped stabilize the market. So in other words, stabilizing utilization has helped reduce medical cost inflation. Does that make sense? And so that's a trend that you need to think about. How are we directing our employees to medical care? Does everybody know what the rule is in the Commonwealth of Virginia in terms of medical care? How many treating physicians?
Three.
Three, right. Can those treating physicians be in the same practice?
No.
Correct, that's right. Yeah, so when you have someone that goes out, just anyone answer this, what's your process? What do you do as soon as you get that accident reported to you?
We have them sign a panel of physicians' choice.
Okay, you have them make an election of which treating physician that they're going to see. Okay. Does anybody know why that's so important? If they don't make that election, what can the employee do?
They go anywhere.
Whatever they want to.
They go whichever doctor they want to and tell them whatever they want to, and the cost could be a
Right.
whole lot more. I mean, it could be a buddy of theirs that lives next door.
Yeah, and they actually have protection under the Act to continue to see that treating physician for the term of the care. And insurance companies can try to get them back on track, and sometimes they're successful, but oftentimes what happens is they'll go start seeing their own physician, then they'll get an attorney, and then things have really gone south. So it's important, and it's not just us looking out for ourselves, it's looking out for the employees as well. So you really need, as the employer, to evaluate which physicians that you're putting on that medical panel. And in some cases, just by proximity to medical providers, you're limited, but there are questions that you should be asking, and one of the questions that you want to ask is to make sure that they've had workers' compensation experience, because treating a work-related accident is a lot like treating a injury that's occurred, an athletic injury, for example. So you want to make sure for rehabilitation purposes that the provider has had some experience with workers' compensation. They also understand the way that the claim process should work and who they should be filing the claim to and so forth. And one critical piece, and we'll talk about this later, is to make sure that they're also doing post-accident drug testing. Okay, so we'll talk about that a little bit later too, but you want to make sure that they have the ability to do those post-accident drug tests.
Now, one thing we do is, we have the 3 medical physicians,
Mhm.
but in our industry, we got a lot of dust flying and things get in eyes, and safety glasses are required, but it invariably happens. So we have an eye doctor on our panel because we found that sending them to the medical doctor, they're just going to refer them to the eye doctor.
Mhm.
So we take out that middle guy and send them right to the eye doctor, and that has saved us quite a bit.
Yeah, that's a good idea. Yeah, so if you know that you have some frequency within your accident trends, that you might have a specialist
Yeah,
on
you
the panel.
focus on,
Right.
specialist.
Yeah, that's great.
One of the other things that helps us is that if we have someone who does not report an injury to us and then they go to the physician on their own, then the panel of physicians does not apply.
Mhm.
What happens then is we may have to pay the bill, but we still can make them elect a panel of physicians.
Okay, yeah, did everybody hear that? So if you have an injury and they don't report the injury to you, but then they elect to go to see a doctor, and then they tell the doctor that it was something that happened at work, that you as the employer still have the right to give them a panel of physicians, even though they've gone to the initial treatment. They did not report the accident to you, so you can still give them the election at that time and get them back into the system and make sure they go see one of the treating physicians that you have on the panel. All right, I think this tells a story in itself, and again, related to sort of the healthcare conversation, these are some just average durations and costs related to different utilization practices. So an emergency room is normally about 2 times more expensive, and the duration is about 3 times greater. So you can see as you start going down through these, and occupational medicine is where you would really like to see your employees go. And there are a few board-certified occupational medicine physicians. There's one here in Roanoke. And some of them have joined the same practice together, so it made it a little bit more complicated. But there are a few out there. But even a general practitioner is going to give you better results. So directing them again to the correct medical care is going to help save you time, and it also is going to decrease the duration of the employee's medical treatment. All right, these are costs that are associated with workers' compensation claims, and you can see that about 38% of those costs go to physicians, 18% is hospital outpatient, hospital inpatient. So you can see the one that surprised me is that 11% goes to drugs. I would have thought more would have gone to drugs, but 11% is still a big number. And in some cases, you know, especially with more of the designer drugs, those costs are inflating. And these are the physician costs. So physical medicine is about 30%. So that could be anything from like physical therapy, and probably you all have had experiences where someone has been injured and then they've had to go to physical therapy. And sometimes that physical therapy route can take a lot longer. But what they're trying to do is to get them to rehabilitate so that they don't have to rely on things like prescription drugs. Because the tail on prescription drugs is a whole lot longer than it is on physical therapy. Surgery is 24%, evaluation and management is 23%, and then some of these others you can see here. But that just gives you an idea of the costs that are associated with either the physicians or just the overall treatment. All right, does anybody know this movie? This is Brad Pitt. Surely you ladies have seen Brad Pitt movies. What's that? Close. This is a baseball movie. Moneyball.
Yeah.
Yes, Moneyball. Does anybody know the story of Moneyball?
Predictive analysis.
Yeah.
This was a team that they got a whole bunch of players that nobody really knew about, and they didn't pay them very much money, but their stats looked really good, and they went into the playoffs.
Yeah.
It's a true story.
Exactly. Couldn't have said it any better. So this is the story of the Oakland A's back in 2001 and 2002. And the coach here, his name was Billy Beane. And his salary for his players was $33.8 million. Which sounds like a whole lot of money to me. But compared to the Yankees had a $110 million budget. So they had to go out and find players that the Yankees didn't want. And so what they did is he brought this guru here, and you can see all like these are, I guess, numbers just coming out of his head. That's not the way my brain works. I don't know. I have a hard time figuring out the tip percentages, and I always normally go over what I think it's going to be, and I know that our babysitters, I mean, they make out really well. But so this guy basically developed an algorithm to help Billy Beane find undervalued players in the market. And so they were looking at things like on-base percentages, and there were other types of variables that they were looking at to build their team around so that they could find these undervalued players in the market. And they did that, and they made it to the playoffs in 2001, and then in 2002, they won their division. So it worked out really, really well to them. And I think everybody has probably heard about big data, right? Big data is a term that you hear about all the time now. And big data is certainly, there's a lot of data in insurance. And so carriers are starting to use that data. So carriers are building predictive models. And typically, they were focusing at first on the underwriting side. But there is very little information that a carrier can find out about your business. That may surprise you, but there is some information that they can find that's financial related information, and they can look at unemployment and a few other things that they rely upon. But there's information that they can find on individuals that is far greater than what they can find about businesses. So what they have started doing is adapting their model so that they're using predictive analytics on the claims end, which means that when you have someone that goes out on an injury, they are running a model behind the scenes based on some characteristics of that injury and the individual to determine whether or not, what type of support they need as a carrier to help manage that claim. It's a little freaky, isn't it? But they are. And one of the areas that they really look at is called comorbidity. Does anybody know what comorbidity means? Yeah, that's another scary term we use a lot in the insurance industry. Comorbidity means that there could be an underlying health condition. So let's say that somebody has an injury, but yet they have high cholesterol, they're obese, several other risk characteristics that are underlying issues. That typically, in the claims world, makes it more difficult for the claim to be managed, because now there's the claimant that's out, but there's these underlying health conditions that could slow their rate of coming back to work and recovering. So carriers are looking at comorbidity because oftentimes too what happens is that somebody has an injury like a back injury, and then all of a sudden that back injury has triggered all of these other things that are happening with the employee. So maybe now there's some kind of pain in their knee, or they've got a pain in their neck. Well, the carrier needs to know whether these were underlying health conditions that existed before the claim, because they're not responsible for reimbursing the claimant with benefits to provide benefits for those other pre-existing conditions. They're only providing benefits for the injury itself. All right, so we talked a little bit about this, and here's what some of the results have been. So you can see that a recent study showed improvements, return to work of between 3 and 8%, attorney involvement reduction of between 5 and 21%, return on investment of 2 to 1 after year 1, and 4 to 1 and 9 to 1 after year 2. So somewhere between 4 to 1 and 9 to 1 after year 2. Travelers Insurance Company report said as much as a 50% reduction in claims costs and a reliable method for identifying at-risk cases for chronic pain. So we're still a little bit early in this, so we'll see what those results yield. But they are saying that these predictive analytics on the claim side is really helping some of the results. And you're seeing a lot of carriers investing more and more resources. So when you are thinking about your insurance carrier decision, make sure that there are questions that you're asking about that carrier. Make sure they have resources like nurse case management, and that's an extremely important function. So the price is one thing, right? But if we can't help you manage the claims, then at some point those claims are going to start to go south, and your results are going to take a dip as well. So look at what the carrier resources are. Ask your agent about those things. So the agent should be able to tell you about what this carrier offers that will help produce these kind of return on investments. Because if Travelers is making this kind of investment, they may be a little bit higher on pricing, but maybe there's some dividend that you get as the consumer because they're investing on your behalf, of course on theirs too. But ask those questions. What does the carrier offer, especially from the claims management side? All right, now we're going to talk about telemedicine. Has anybody used telemedicine here?
We had an employee use it.
Yeah?
Yeah.
What was your experience like?
I thought that was really cool because I didn't have to leave work.
Yeah, you didn't have to leave work. How was your experience?
Very good.
Good. Okay. Did you all use it for just kind of your, everyday sort of like sinus
Yeah.
type deal, or something simple, right? That
Yeah.
you didn't feel like needed immediate emergency treatment. Yeah. So telemedicine has become really popular, and a lot of the health benefit plans have telemedicine built into it. And I tried it about 3 weeks ago, and I was able to do it from my office, which is nice because I didn't have to go anywhere. You don't just sit in the sick waiting room.
It's more sick.
Get more sick, exactly. So what it did is it connected me, and then it asked me if I would submit my medical records. So I had to click an agreement to do that. The medical records were sent, and then it brought up a list of physicians. And it's like Facebook. You can see these physicians, and then they all had ratings. So from other people's experiences, they rated the physician, on a scale of 1 to 5 as to whether that they felt that was a good experience or a bad experience. So I looked at what their specialty was, and then I selected the physician that I thought was the most appropriate. And then it took about 10 minutes to connect, but that's because the physician was reviewing my medical file. And so then we connected, and it was an older gentleman who looked like he had his lab coat on and was like sitting in his basement. And so he did his screening with me, and here I am in the office, and he's not asking to like look up my nose. I was kind of wondering how that was going to go. But I didn't have to turn on my flashlight for anything. So he was in Portland, Oregon, but yet he knew that this was ragweed season here, and he made the determination that it wasn't a sinus infection, it was allergies. So then he made his diagnosis, and I get an email, and here is all of his notes from our meeting, including the diagnosis and what I should be picking up as the treatment. So it was a pretty cool experience. Now, workers' compensation has decided that we're going to invest in telemedicine. So there's some companies that are doing this, but I'm telling you this is an emerging trend. So there's not a whole lot of companies that are doing this right now. So just keep that in mind for all the people that are here that you didn't talk to us about. So telemedicine is giving you rapid access to physicians experienced in occupational healthcare. So the benefit of this is now, if you're in a place where you don't have access to occupational medicine, you could through telemedicine. And the great thing is that you could be hooked up with some of the best healthcare providers in the entire country through your phone. So you have virtual access to specialists, connectivity to National Occupational Medicine, virtual follow-up care, logistics necessary to prevent long wait times and connect the caller to the right resources. And then the bottom one here is just telling you that basically there's the technology to be able to make this work. So what I like about this is that oftentimes what happens is that that initial treatment is the most important visit, because that establishes their medical treatment plan. And if you don't have somebody that's specialized in occupational medicine, you don't want them to experiment on your employee with their first workers' compensation assignment. So what this does is establishes that medical treatment plan at the get-go, and you can do it extremely fast. And typically what this is doing is just setting up the process for the insurance company, because once that telemedicine call has been made, now the insurance company knows what resources they need to engage. If the employee needs a specialist, they can already start working behind the scenes to make sure that they can get an approval to see that specialist. And oftentimes I have seen that that is where cases really start to go south, is in the period between the initial treatment and when they go to see a specialist. So if you have somebody that's injured and the recommendation is that they go see some kind of specialist, a 2-week wait time, you got to explain why is it going to take 2 weeks? Can we get something sooner? Can you find us a different specialist? Because I'm not going to say that every insurance company is honest, and I'm not going to say that they're dishonest. I think that there's sometimes it's right in the middle, right? So what I'm saying is that I think that it's important that if you have this type of technology available, that you give your employees that availability to be connected, because it's going to help them with their medical treatment plan. And the insurance company hopefully will be able to get more responsive in their times, because if 2 weeks is going to be malingering pain for the employee, the first thing they're going to do is put them on some kind of opioid to get them to reduce the pain, right? And that could spin things completely out of control. So it's important, I think, that insurance companies are starting to address that wait time through technology like telemedicine. Telemedicine sounds so out of date. It's like telephones. I mean, what's next? Like, fax medicine. All right. Now we're going to talk about marijuana and workers' compensation. We're going to talk about 2 areas. And hopefully you all have kind of been paying attention to the news and noticing that more and more states are becoming marijuana friendly. And this tells you some facts here. I think there's like 26 or 28 states now that now have decriminalized marijuana. And so this is what's important to remember, is because when you have someone that goes out on workers' compensation, these states that have decriminalized marijuana, that have dispensaries and all these other kind of things, they are thinking about using marijuana as part of the treatment plan. So if you have an injury in Maryland, and DC are two decriminalized states that border us. If you have a situation like that that occurs in those states, and you have a prescriber that recommends that they use medicinal marijuana as part of the treatment plan, the insurance company is not going to reimburse. I should say, yeah, the insurance company is not going to reimburse the provider for the medicinal marijuana. And these are the reasons why. Is that it still remains illegal under federal law, and it's a Schedule I controlled substance. It's not FDA approved. Marijuana is not approved by most medical governing guidelines and would be denied in a utilization review. And then also there are no assignments of a prescription drug code. So there's no prescription drug codes, and that's what healthcare companies use for reimbursements. So you're not going to find an injured employee that's going to be able to get their medicinal marijuana paid. Now, I think the flip side of this, which is kind of more relative to us, is whether or not the insurance company would pay benefits to somebody who was injured for using marijuana. Has anyone had a situation like that, where they failed a drug test and the insurance company has denied their claim because there was marijuana persistent?
For driver.
For a driver. Okay.
I have a question for you.
Yes.
For the workers' comp medical care provider, would they in those states know that medicinal marijuana would not be covered by workers' comp?
I don't know if they would know that or not. And there has been a couple situations where the workers' compensation was forced by the state to pay it, but the only reason was because they tried other treatments and they all failed. Okay, so it was like a last case resort, so there's a very special exception for that. But going back to the other question as to whether or not it would be covered, the insurance company basically would have to prove that that the result of the injury was related to the use of marijuana. And that's kind of difficult to prove. In several cases that I reviewed, if you look at case studies, there are some that did not get the benefits and some that were awarded benefits. And the trend that I saw is that it depended on who the expert witness was. So if the insurance company had the better physician that was doing the expert witness on their behalf to say that no, the marijuana, or yes, the marijuana did lead to the accident, then typically they won. If the employee had the better expert witness, then they won. So there was two things that they looked at, and one, and these apparently are related to the drug test, is that they can tell by the dosage of some kind of, I don't know what it is, but there's some kind of substance that they can review in that drug test that will give them an indication of when they last, ingested marijuana, or inhaled it, I guess. And then there's another test that will tell you the level of THC, and not all tests will tell you both. So the THC is what gives you the high, and so if they can prove that it was the THC that was in their system, then they're more likely to deny the benefits. But if they can only prove, when they last took the marijuana, then they may have a more difficult time proving the compensability. So it's kind of an interesting thing, but when you run into that, this is sort of like that gray area in workers' compensation. Just because they failed the drug test does not mean that the claim won't be compensable. All right, we're going to look at provider reimbursement rates, and I tried to get this slide to show up better, and you're not going to be able to see these states. So the point is that there are 50 states listed here, and Virginia is right here in this green area. All right, so this is something that's getting ready to take effect January 1st, 2018. So you can see that in most states, which would be all of the states that are gray, they all have provider reimbursement rates. So Virginia is one state that does not have a provider reimbursement rate, which means that if someone goes out for an injury and the treating physician sends you a bill, well, there's only so much they can charge as a result of that injury. So provider reimbursement rates have been established in all these states with the exception of these four, Virginia being one of them. So this purple line that you see here is pretty much how workers' compensation establishes those provider reimbursement rates. And basically they follow Medicare. So you can see that Virginia is way in excess of what Medicare provides. And look how the trend is for all the other states. So it has helped reduce that medical cost inflation, okay? Because there are provider rates. So effective January 1st, 2018, Virginia is adopting medical provider rates, all right? So they're going to be more consistent with the rest of the country. That could be interesting because there could be some medical providers that decide we don't want to play that game, so we're not going to accept workers' compensation anymore. So there could be some changes with the different medical providers on how they feel about these medical reimbursement rates. But it will certainly impact the workers' compensation market in Virginia because I think it will result in pressure on that medical inflation. So for consumers, that could help workers' compensation premiums. It's going to take a little time for that all to set in, but that is something that is going into effect January 1st. So that's the first time that Virginia has adopted a medical provider rate.
When that happens, will that affect existing open cases as well?
That's a good question. I don't know. I don't know the answer to that. I'll have to look into that and see if it would affect existing cases. I don't know. I mean, on something that would be considered a new treatment, I would imagine it would. But if it was just resulting from something that was performed prior to January 1st, I don't think so. But I'll look into it to find out. Okay. And then we're going to talk about these three topics here, which is the opioid epidemic, drug testing, and what we call the gig economy. All right, so this graph here I think is pretty startling. If you look at the number of opioid prescriptions, it's increased from 76 million in 1991 to nearly 207 million in 2013. It's a lot. Nearly 100 million Americans report chronic pain, 1.27 million emergency room visits from opioid overdose, 33,000 deaths in 2015, which is 3 times more than a decade ago. And a third of long-term users report being addicted to prescription opioids. And then just a study on workplace, 70% of workplaces have been impacted by employees' misuse of prescription drugs. So I did a little research on this, and I don't know if anybody saw it. Did any of you see that 60 Minutes that they just, was that 2 weeks ago?
Mm-hmm.
Yeah, that was pretty startling. But basically in that 60 Minutes episode, what they had is they had someone there that was basically a whistleblower that said that there has actually been less restrictions on pharmaceutical companies as a result of lobbying efforts. And whereas, the kind of perception is that this is the problem, I'm sure that people are doing something to address it. And, how things get in politics, right? So this person was making a case that, no, actually it's gotten worse. And I was one of the heads that rolled by trying to do something about it. But I wrote down some, and is everybody familiar with what an opioid is? The types of drugs that are associated with opioids? Okay. Partly what they're saying resulted in this explosion of prescriptions that were being issued was a result of a 1980 medical journal. And in that medical journal, they cited that addiction was rare in patients treated with narcotics. And that statement right there allowed pharmaceutical companies to basically advertise that, hey, there's no real science showing that there is addictive behavior as a result of opioids. So that kind of flooded the marketplace. There were a big push in the 1990s from medical groups that doctors were under-treating pain. So when you think about what the medical experience is like, right? We just talked about insurance being meaningful and rewarding. So we talk about what the medical experience is like. If somebody is leaving your clinic and you're the doctor, you want to make sure that number one, what? They're not in pain, right? You all have probably seen there's like these faces that they have, these smiley faces, like one is smiling and one is like crying and just terrible pain. They'll say, point to the one where you are, right? If you're on the crying side, they're going to try to figure out a way to comfort you. So I'm not trying to make any kind of allegation that I feel like that there are doctors that I would say that the majority of doctors are trying to treat pain in a responsible manner, but there are those that aren't. And Opioids has become a serious issue, and it certainly impacts workers' compensation. Because when someone starts going through a pain management plan, then obviously that case is going to take longer and longer to close. And I've seen instances where, unfortunately, they have lost all motivation to come back to work. So it's kind of a spiraling effect. And our part of this state, which they call Appalachia, they don't call it Southwest Virginia, it's Appalachian. I guess Appalachia must, yeah, Appalachian Mountains, and it probably includes other places other than Southwest Virginia. But we are one of the top areas in the country for prescription opioids. And West Virginia is right in there behind it. In fact, there's a new Netflix documentary that just came out about opioids in West Virginia. And this was interesting. Between 2007 and 2012 in West Virginia, there was 280 million doses of opioids prescribed in the state, which was enough for every resident to have 433 pills. Does that tell you how bad things are, right? So it's something that we look at a lot in workers' compensation cases because we want to know what that pain management plan is. And there are some workers' compensation, again, that are better at others that are using data to support when they can start weaning these employees off of that prescription drug. And they also have other resources available like nurse case management and their own payment management teams to make sure that the doctor is being responsible on their prescriptions. So that's another question to ask is just what type of resources, again, does your carrier offer to help manage the claim? This is just some more facts here, and these are in your booklet, so we don't need to beat this thing up, but it's certainly something that carriers are taking a look at. And then this is a topic that just came up, so post-accident drug testing. Does everybody here do post-accident drug testing after an injury? Okay, yeah, all right, so here we go, it's a little murky situation. So OSHA just published a final record-keeping rule, and what they've established is that there must be an objectively reasonable basis for the testing, and that you've also got to have those testing procedures explained in your policy. So what's interesting about what this means, there must be an objectively reasonable basis for testing, is they're saying that you can no longer blanket test everyone. And the reason that they're saying that is because we don't want to discourage people from turning in workers' compensation claims. So you've got to be able to make that determination. Here's something fun for you in HR. Is make the determination as to whether or not drugs were related to the accident. That's what caused the accident or not. I mean, who wants to be in that position, right, to make that call? But that's what OSHA is saying that you should do. So we put a sample post-accident drug testing language here that came from one of our carriers that we liked that kind of takes you out of that position. And it says basically the employer will conduct post-accident drug testing unless the immediate facts of the accident indicate that impairment of the injured worker could not have played a role in the accident occurring. Which means that we're going to test everybody. That's basically what that means. And we're going to put this, very vague policy in place saying that, well, you can't fault us for our wrongs because we did what we thought was right. So, as I learned through one of my presentations, actually from these two here, and updated my presentation, was to talk about some exceptions. And in Virginia, we do have an exception. So if your state workers' compensation insurance program allows or mandates post-accident drug testing, is anybody getting a post-accident, or I should say a drug-free workplace credit on your workers' compensation? Yes. And what do you have to do to get that credit?
Reemployment, post-accident.
Reemployment, post-accident, random. That's correct. Yep. And if your state workers' compensation insurance plan gives you a discount for your insurance premium, then the Virginia rule states that every insurer providing coverage pursuant to this title shall provide a premium discount of up to 5% for every employer instituted drug-free workplace program. So what that means for you is that if you are doing your post-accident drug testing to get the 5% premium credit, then you may proceed with post-accident drug testing on a blanket basis.
Oh, also, if you're a government employer, if you're a government contractor, you have to follow drug-free workplace policies, and that is included as a contractor. You have to do post, pre, random.
Right.
So government contractors are also exempt
Mm-hmm.
from the OSHA rule.
Right, CDL drivers would be another exemption.
Department of Transportation.
Who has heard of the gig economy? Do you know what my favorite term for this is? It's a little side hustle. Nothing wrong with a little side hustle. So this is something that we are looking at now too. And does anyone know what these icons are? Yeah? Have you seen them all? There's some up there that were confusing to me that I did not know. I still don't know what this is. This is a company called Deliveroo. And so instead of using UPS or FedEx, if you want to just give your package to the person that's on their moped, you can do that. And they will take it for you and they will deliver it and give you confirmation that they delivered it for you. So there are people out there that are making deliveries, helping you kind of cut out the FedEx and the UPS and the post office service. Etsy, anybody used Etsy before? Yeah. Anybody addicted to Etsy? This one right here is called TaskRabbit. TaskRabbit, yeah. So TaskRabbit means that if you've got a task, it doesn't matter what it is, if you need to just have some drapes hung in your living room, you can go onto TaskRabbit and see if there will be somebody there that will agree to put your drapes up for you.
Oh, that's awesome.
Exactly.
Sorry.
Yeah.
Right there.
It's too bad this wasn't around, Mom. When Dad and I tried to replace the toilet paper spool and lost about 65 toggle bolts behind the drywall.
That would have been a help.
And then this is another package company. Of course, this is Uber. Yeah. So today, about 16% of workers work for a temporary help agency as independent contractors. Should just say independent contractors. Their employers don't contribute to workers' compensation, unemployment insurance, or Social Security. So they get it pretty good here. They've got all these people working for them. They're bringing money back to this company, but yet they don't have to pay any of these things. So there's 28 states, including Virginia, that have established regulatory framework for ride-sharing services to uphold their independent contractor status. So do you think there's some lobbying efforts going on behind the scenes to make sure that they don't have to pay taxes? I'm sure there is.
Well, we're having to pay.
Yeah, so how could this impact you as an employer, the gig economy?
If it's a side hustle, we're paying for it if they get injured.
Right.
There you go.
Yeah.
They get injured, and then they come back to work. So they're working normally on a part-time basis. They get injured working for one of these folks that don't provide any type of benefits, and then they come back to work to you, and they report a workers' compensation claim. So there is acknowledgement by a lot of people in politics that this doesn't seem like a framework that's fair to the employer. And so one of the senators that's trying to figure out something for this is Senator Mark Warner. And one of the plans that he has is to create a portable benefit plan that these employees and employers would pay in, and these portable benefits would allow it to cross state lines, and they would be able to have some kind of benefit plan in place if they did have an injury while working for one of these employers, to kind of alleviate the pressure for employers that are paying those benefits on behalf of the employees that actually weren't working for them when they got injured to begin with. So we'll see how that develops, but right now there is a push to look further into these side hustles to figure out whether or not we can establish some kind of benefit framework for them. So we'll see what happens there, because some of the plans are for the employers to pay for those, and some of them are the employee would pay into that benefit plan, and they would actually deduct part of their wages to pay towards that plan. So I think it's probably going to be a little bit of both at some point. So we'll see how that develops. And there was an article in the Roanoke Times about, we put it on our Facebook, what was that, 2 or 3 weeks ago?
Yeah, it was like 2 weeks ago.
Yeah, it was about the gig economy. If you haven't read it, you should read it. It was interesting. Let's put some things on here. There is one that started here in Roanoke called Big Lick Boomerang. And Big Lick Boomerang is a designated driver service. And oftentimes, if somebody's had too much to drink, they'll call an Uber, but then they have to leave their car. So in this case, what happens is 2 cars show up. One person leaves, the other person stays with you, and they drive you home in your car, and the other person follows you to the destination, and they get in the other vehicle and drive up. So you are there with your vehicle for the next morning. So Big Lick Boomerang is one side hustle happening in the Roanoke Valley. Welcome back. Everybody stayed. Nobody ran to the door. We keep them locked. That would be very poor risk management practices. And for any of you that are dealing with the sunshine through this window, I tried to get up there yesterday and fix that blind, and I should have remembered TaskRabbit. It didn't go very well, so appreciate you. You might, we've got some FPF 15 if you need it. All right, we're going to talk about some legislative changes. The first one that we're going to talk about is the NCCI audit non-compliance rule. Has anybody seen this endorsement come in through the mail from the insurance company? I'm sure you all get really excited when that mail comes. Yeah. All right, so the NCCI audit non-compliance rule we're going to talk about, and we're also going to talk about OSHA electronic posting requirements. Okay. So the first one is the audit rule, and it's effective January 1st, 2017. And here's what that endorsement basically says, is that the carrier must make 2 attempts to obtain your audit information. Hopefully everybody here is pretty compliant as far as the audit procedures are concerned, but there are some people that aren't as compliant. And now NCCI has decided that they're going to make some changes to support the carrier. So the rule allows a surcharge of up to 2 times the annual premium for failure to cooperate. So, yeah. So they're making a pretty bold statement here, saying that I think you're going to want to participate in our audit. The charge is rescindable and refundable if the insured completes the audit process. So even if you get charged for this for not completing, and then you come back and complete the audit process, they're going to reimburse you for the money. But if you get this endorsement, I mean, it's kind of awakening. So we've had some people that have asked us about this, and we've said, yeah, you just need to make sure that you're available for the auditor. When I say that, though, I also have done presentations on audits before, and that's something that we'll probably revisit it at some point. But if the auditor does not want to operate around your schedule, try to get them to understand that, or contact me, because so many times I've had the auditor basically just send a form letter saying I'm going to be at your premises on this date at this time. Right. If that doesn't work for you, let me know, and we'll get the auditor to come back at a different time. If you feel like the auditor is, conducting an IRS investigation, that's not the way you should feel, all right? So if that's the case, let me know, and we'll make sure that that auditor does not get assigned. We can help be the answer to some of these problems, and we have had some auditors in some cases that have worked for third parties where the audit process did not go well, and we have made sure that those auditors do not come back and that they don't see future clients. So if it's an unreasonable process, let your agent know about that, because we can do something to fix it. So this is just, reiterating that that's coming out on all workers' compensation policies. So if you haven't gotten the endorsement yet, you can probably get one, and that's what that rule means. All right, now on to the OSHA electronic reporting. And so when I was thinking about how do I explain this, I thought about just answering the question who, what, when, and why. All right, so we're going to look at, this is an overview of what this electronic reporting rule is. Is anybody familiar with this?
Yes.
Yeah? All right. Fortunately, it's something that we're probably all going to have to be very familiar with, because it requires employers with 250 more employees to submit the Form 300A, and everybody knows what the 300A OSHA log is, by December 1st, 2017, electronically to OSHA. And the deadline has been extended, so it was from July 1st was the first requirement, now it's December 1st, 2017. Now, employers with 20 to 249 employees that are classified in certain industries must submit the Form 300A also by December 1st, 2017. If anybody's interested in that full list, I'll send it to you. So if you want me to provide it, I will, but I've put in here includes but not limited to construction, manufacturing, retailers, wholesalers, nursing and elderly care facilities, hospitals, and community relief. Did I cover everybody in here? I didn't, Sheree. You're right. I think there might be an exception for you. I'll have to look into that. I'm totally responsible for that, by the way. Some data will be posted onto OSHA's website for public consumption.
That's the problem we have.
So we'll have to think about the why with that question there. So who does this affect? All right. So it's based on the size of the establishment, and I should put establishment in parentheses because establishment is a well-defined rule by OSHA. And you can have one or more establishments under the same roof. That doesn't happen very often. But if you have an establishment, that just means that you have one enterprise, that's your corporation, that you have similar operations and similar management, that would be considered an establishment. So you could have more than one establishment in different locations, but there are certain exceptions for permissibility on the filing of the OSHA 300 law, and you have to look at the OSHA rule for that. But for most general cases here, and I can't think of anybody that would be an exception, you would be considered one establishment. All right, so to determine if you need to provide OSHA with required data, you first need to determine the establishment's peak employment during the last calendar year. So those are your numbers that you're using to determine whether you fit in the 220 to 249 category or the 249 or 250 and above category. So it's looking at your peak. Yes?
Excuse me, Stephen, let me refresh here.
Yes.
If you have different offices in different localities, well, what is that about the 500? Well, we have 400 employees, but in 3 different locations.
Right.
Would that be
Same management?
Yes, it'd be considered one establishment.
different management at each location?
Yeah. Does everybody, do the payroll reporting all go under one?
Yeah.
Yes.
So we need
it's going to be
one.
It's going to be one establishment to calculate those numbers.
Okay.
Yes.
Thanks.
Each individual employed in the establishment at any time during the calendar year counts as one employee. And that includes full-time, part-time, seasonal, and temporary workers. So those all go into your counting basis as well. So if you have over 250 employees, then you've got to electronically submit OSHA forms 300, 300A, and 301, but there's a timeline for that. So right now we're focusing on just the 300A. Establishments required to keep OSHA injury and illness records for just 300A, and that will be for the life of the rule. It's 20 to 249. If you have less than 20 employees, then you just follow your standard OSHA reporting procedures. You don't have to electronically submit your information to OSHA. And these are the 3 reports that you're going to be submitting. So the Form 300 is a log of your work-related injuries and illnesses. Your Form 300A is your summary of work-related injuries and illnesses. And 301 is injury and illnesses accident report. Does everybody understand what injury and illnesses mean? That would be anything from a cut, fracture, an amputation. Does anybody know the amputation rule that went into effect about a year ago? If you have an amputation, how long do you have to report that to OSHA?
It's the same as that.
Right. It's 8 hours if what?
It's the same as that.
Okay.
Yeah.
And that includes the tip of the finger. And we've had situations where somebody has just cut off the very tip of their finger. It happens a lot in construction. They'll cut off just the end of their finger. It could happen in material handling as well. But you have to report that immediately to OSHA. Okay. And this is the data that you must submit. So these are all the things that you've got to report on that OSHA 300. The company name, the establishment full address. You can see there's quite a variety of fields that you've got to complete just based on that OSHA 300A form. Okay. Any questions on this? Yes.
are those reports online somewhere that you just fill them in and then send them in? I mean, like a tax return or?
You're getting ahead of the presentation.
Good question.
It's a very good question.
Well,
It's a good question.
I done the 1094s and 1095,
Uh-huh.
you know, on the healthcare side. I mean, people are always saying, how do you upload that thing? And if you read the instructions, you know, the government gives you, I mean, I don't know how people
Yeah.
understand how to do it.
And it's supposed to be written on a 6th grade level. Must be a magnet school. All right. So then this is the win timeline. So by December 1st, you got to file the OSHA 300A, and that's for all of the segments, 20 to 249 and the 250 and above. On July 1st, 2018, now those establishments with 250 or more employees have to submit the 300, the 300A, and the 300 employee. You can see that for 20 to 249, you stay with just the 300A. But then the reporting requirements change to March in 2019. Okay, so from this point on, everything will be filed on March the 2nd. I don't know why that's the magical date. Does anybody know what March 2nd?
It'll change.
Right, very well changed, exactly. So this is the timeline, and you've got that in your books, and if you all want copies of some of these slides, I'd be glad to send them to you. But that's the timeline. Okay. Any questions on that? All right, now the why. So why does OSHA believe like this is in our best interest? OSHA expects that this rule will help improve workplace safety through expanded access to timely, establishment-specific injury and illness information. The rule will provide OSHA with data to assist the agency in compliance and enforcement. Now, the enforcement part is a very small font, but the enforcement piece of it is also important to them. And they're trying to make sure that this is something that they feel like is going to be advantageous for the employees as well. So if there is the savvy employee that wants to do an investigation of the employer that they're getting ready to go to work for, they can go on to the OSHA website and see what kind of accident trends they've had. And that may tell them whether this is going to be a safe employer to work for or somebody that maybe is not as safety conscious. They've also resorted to behavioral science, which suggests that public disclosure of the data will nudge employers to reduce workplace-related injuries and illnesses. And they actually use that word, nudge. They decided that was a better term than shame. So, they want employers to understand that, hey, listen, this is going to be an incentive for you. If you don't want to be on the naughty list, then you want to make sure that you're keeping best practices related to safety. And finally, the access to establishment-specific data will enable employers to benchmark their safety and health performance against other industry peers. So you will be able to look at that. And there will be some companies that will start promoting safety when they are looking at bringing on new hires, because they will be able to use real data to benchmark their performance against their company peers. So I think in some larger corporations, if you go to like Pepsi Cola or you go to Coke's webpage, you ought to see the information they put out there about their safety. If you all have great safety plans, make sure that your agent knows about that. That should be the questions that we ask you, is what are you doing that separates yourself from the pack? Because there's a 3-page application on workers' compensation. 3 pages. That 3 pages does not summarize, and it asks one question about whether or not you have a written safety program. That's the only question asked on the application. If that's the only information that I'm providing back to the carrier, you look like the other 100% of companies that have checked the box that they've got a written safety program, because everybody checks that box. Okay, so if you've got a safety program, make sure you advertise that. Not just to me, put it on your website too. Because from an underwriting perspective, they're going to your website to see what you're doing. So if you've got lists of projects that you've done in the past, if you built one rocket ship in your lifetime, I wouldn't put that you build rocket ships. If it was back in 1980 and you plan on not building any more rocket ships, don't put that on your website, because it may have a coolness factor, but it's also going to ding you from an underwriting perspective. Okay, so how will the electronic submission process work? So on August 1st, 2017, OSHA launched its injury tracking application, which is a secure website for the electronic submission of OSHA record keeping information. I will also tell you that on August the 22nd, they got hacked. Tells you how secure the information is, but they have closed those loopholes. So there are two methods. All right, so one option is that you can upload the data yourself. You can go to the IPA tracking thing, and then you can put all this stuff in.
So you're personally responsible.
Which means that if you're keeping paper copies of these OSHA 300 logs, then you're going to have to go in and put all of this data in one field at a time, which, you know, there could be some mistakes made just by the nature of trying to transcribe data from one, you know, hard copy to now an electronic copy that goes into their system. And you know, they've been known to have some glitches before. I think that the Exchange had a few glitches when they introduced the Exchange. So I don't know. We'll just assume that things will go well with that. So the second one, so the uploading, I should say that the uploading information is if you have your own software. Some companies offer some software where you can put your own electronic OSHA reporting information directly into the software, and then you could upload that information to OSHA through a CSV file. The other second option, which we just discussed, is the manual side of operations, okay? So then the question is, how can we help you, right? And so what we have done as an agency, and just to give you kind of a story of how this all came about, is that when I started in the insurance business, I went to work for a company called Wallace, Welch & Willingham. Try to say that 3 times fast and make sales calls. So yeah, you know, I just call them Tri-Dub. But so Wallace, Welch & Willingham was a company in St. Pete, Florida. And so instead of the burden of my parents accepting me into employment at commercial insurance services, they pawned me off to St. Pete, Florida, which actually was appealing to me because when I accepted the job, it was in January, so I got to go to St. Pete, Florida, which was a nice escape. But in that program, I met a gentleman that was in an agency in Michigan, and we had all met each other actually prior to this, and they selected 12 candidates countrywide to be a part of this program for an entire year. So I was one of the lucky few that got to go. And I met this guy in Michigan, and I have not seen him in like 13 years. And then we reconnected at a Keystone meeting, and we started talking, and I asked him what he'd been doing, and he said, oh, you know, I'm doing really well on the agency side, but I've actually also developed a software. I said, really? Okay, yeah, well, enough about me. Let's talk about you. And he told me about the software that he built, and the software takes care of your electronic reporting. So I said, hey, do you think we could partner together? And he said, I don't know. We haven't seen each other in 18 years. I said, well, I can assure you things are going well at Hawk. And so we talked a little bit, and he said, okay, fine. So we now have this software available to everyone called OSHA Logs. And what OSHA Logs will allow you to do is to automatically generate OSHA 301, 300s, and your 300 summary, and your first report of accident. And it's all on a cloud-based platform. So what we will give you are login credentials, and you will be able to change the way that you are recording your OSHA accidents. You will type them all into a field, and that field will actually pre-fill any other parts of the OSHA information. So there are areas where you've got information that is the same on all 3 of these documents. So instead of having to go in and write all 3, you do it one time and it pre-fills the other 3 forms, okay? The other thing that it does is it allows you to select your first report of injury. And I think we have a way to customize it so that you could actually send it directly from the carrier from the software. So is this going to make your life a little bit easier? Because the great thing about this is that once you've entered in all of your information, it will then allow you to convert it to a CSV file and upload it to OSHA, and you're done. You don't have to do anything else. You don't have to take your paper copies, and it can be done on any device. So if you can train your employees, you know, to use a tablet or a smartphone or a computer to be able to do whatever the OSHA reporting is, then they can do that all online. And you do not have to fill out another paper OSHA 300 log. You can print them, you can post them, and it also will give you a trend of all of your accidents. For those in construction, it will give you your DART rate, it will give you your incident rate in real time. So if you have to be bidding on a project, it will give you all that information in real time. So it's a really exciting partnership, and there is no cost to you. So what it will do is it will actually ping us in our emails when you have had an OSHA 300 incident. And the reason that we do that is so that we can assist you. And if there is an issue, then we're on top of it, so we get that information as well. But all of this information will be available to you at a later date. Literally, the ink has just dried on the contract. So as we start to roll this thing out, I'll keep all of you on notice, and we'll establish those login credentials for you, and we'll do some training. And we'll probably do some training that are specific just on this platform. And we've got now this nice video equipment that we got from Lee Hartman and Sons. And we're going to be able to film some of these presentations too. So look for things to come, but we're going to try to answer this burden for you so that you can do all of this reporting and upload your file rather than doing manual entry. Okay?
How does that correlate with reporting to the carrier?
The 300 log?
Well, this software, when you're reporting it to your insurance carrier, this goes to OSHA.
Right.
You still have to report to your
Right.
workers' comp carrier.
That's true. So also built into this is your first report.
So you just do that and then they'll accept that, or?
So I have to look into that more, but what he's told me is that there's a drop-down screen. And you select your carrier, and you should be able to submit it electronically from the system. Yeah.
When will this be available?
Should be pretty soon.
Before December 1st?
But before December 1st, yes, before December 1st, we'll have this available for you.
So like in the next 6 weeks?
You know, and so we're very careful on what kind of technology we introduce, because I think that there's these technology platforms that a lot of agencies get super excited about, and if there's anybody that is a sucker for technology, it's someone in insurance. You tell me that there's technology that will alleviate, the troubles of my clients and myself, where do I sign? I don't care how much it costs. But the problem is that it's not very engaging with our clients. So I don't want to purchase something on your behalf and then sell it to you as a benefit if you have had nothing to do with it, right? Well, this kind of solved that problem for me because it's extremely easy to do. It's very intuitive, so I feel like everyone can do it, and it's not cramming all of these other components into it. It only does two things. It does your OSHA reporting, and it does your first report of injury. That's it. And the engaging part for us is that if we're getting notified when you've had an accident, then we can start hopefully getting to some of these things on the front end and having conversations with you about it, if you want to have conversations about it. At least we've got the same information that you're looking at too, okay? So we'll let you know when this becomes available, but it should be out pretty soon, definitely before December 1st, okay? And that concludes our presentation.